Hello, everybody, and welcome back to the Sanctuary. I'm your host, Professor C, and we're going to do some more A&P today. Specifically, we're going to take our second major exam today, where I will be covering a lot of questions over bone histology, the entire skeleton, and joints. So, let's dive in. So, just like the last major exam, we have a lot of fill-in-the-blank questions, and I'm going to go through them. Slowly raising them up so we can just barely see them at the bottom of the screen. And if you want to pause the screen and try to take the exam yourself, you can do that. But then I'll give the answer fairly quickly. The hypodermis is largely composed of blank, a specific tissue type. So that would be the same thing as subcutaneous layer. That would be adipose tissue, adipose. The deepest layer of the epidermis. All right, so it's corny, loosey, granny, spiny base. And base reminds us of basal or basale. Stratum basal, stratum basale. Cells within stratum blank contain dark staining granules. Okay, this should remind us of stratum granulosum, named for the dark staining granules, and that is a granulosum. Melanin can color the skin and the hair, but its major function in skin is to. And of course the answer here is to protect nuclei from UV exposure. There's a variety of ways to say that, but that's how I would say it. The most superficial layer of the epidermis. Okay, that's the very top one. Again, corny, loosey, granny, spiny base, so corny. So the more superficial is stratum corneum, and then it contains a waterproofing protein called keratin. The dermis consists of two layers, the papillary, which is characterized by a lumpy interface with the epidermis, and the blank layer, which accounts for 80% of the dermal thickness. So we have the very small papillary layer, and then we have the larger reticular layer where all the goodies are located in the dermis. Reticular is the answer. Within the papillary layer, small nerve bulbs called blank corpuscles sense light touch. That would be the Meissner's corpuscles, light touch. What is the function of the stratum basale or basal? Well, we just went over that's the deepest layer, and that is the layer that's one cell thick only, and it is for mitosis, right? This is where new cells of the skin are formed, at least the new cells of the epidermis. The ducts of blank glands, a type of sweat gland, open into hair follicles rather than directly onto the skin surface. Okay, if it went straight to the skin surface, it would be an eccrine sweat gland, but since it uses hair follicles, this would be an apocrine sweat gland, to keep it the simplest answer as possible. There are some variety you could put there, but apocrine is a really good bet there. Blank glands are sudoriferous glands, which produce a waxy substance to protect the ear canal from dust, small insects, and so forth. So ear canal is the key here. That would be ceruminous glands. Blank glands secrete an antibacterial oil called sebum onto hair shafts and skin to make you look shiny. Of course, this is important in mate selection and looking healthy. So which glands do this? Well, the sebum is the key here. That would be the sebaceous glands. The muscles that allow hairs to stand on end and cause a phenomenon known as goosebumps in Western culture are that would be the erector pili muscles. The thinning of hair that both genders over the age of 40 experience is called alopecia. Alopecia. Not quite balding, but thinning of the hair. Blank is the most dangerous type of skin cancer. It can be cured easily by excision until it metastasizes, after which the prognosis is poor. These cancerous growths can be identified using the ABCDE rule, and these, of course, are the melanomas. Melanoma. In blank degree burns, the epidermis and upper region of the dermis are damaged. Blistering is common. Well, since it involves the dermis, it's a second degree, and that's the answer. Second degree burn. Not the worst, not the least. In blank degree burns, only the epidermis. Okay, that's the least of the burns. That's first. Remember, first is not the worst. First is the best type of burn if you're going to get one. All right, scrolling here. The area of a body covered by a burn is estimated using the rule of blank, which divides the body into regions, each containing a defined amount of the total body area. So this is called the rule of nines, right? The rule of nines, where each major part is 9%, or 18, or 4.5. The largest and, oops, gave one away. The largest and strongest bone in the body is the femur, the thigh bone. The shock-absorbing cartilage found in the intervertebral discs is made of, that's fibrocartilage. Bones of the skull, the vertebrae, and the thoracic cage, rib cage, make up the blank skeleton. Well, it's either axial or appendicular, and these are the parts of the axial skeleton. The tubular shaft of long bones is called the diaphysis, which is mostly composed of compact bone. Blank is found in the medullary cavity of an adult's long bones. It is composed of fat. Well, that would be the yellow marrow. Yellow marrow. Blank are the expanded ends of long bones. Well, up here, if the shaft is called the diaphysis, the expanded ends are called the epiphyses. The epiphyses. A long bone is covered with a membrane called a blank, under which osteogenesis occurs. This is the periosteum. The periosteum. A raised lump on top of a condyle is called a blank. Now, a condyle is already a raised lump on a bone, so this would be an epicondyle. Blood vessels and nerves may move from one haversian canal to another by detouring through a and blank canal. Those are the ones that go not up the length of the bone, but, horizontal to the length of the bone. And these are called perforating canals. In some books, they call them Volkmann's canals. Cells that dissolve bone are called, okay, so this would be bone breaker, osteoclast. Osteoclast, a bone breaker. Calcium resorption from the skeleton is primarily regulated by the hormone PTH, or parathormone. A blank fracture is a result of a bone being twisted with great force, such as in a sports injury. You could call that a torque fracture. You could call that a spiral fracture. Jumping off of the roof and shattering your tibia would be an example of a blank fracture. Keyword is shattering, and to parts, that would be a comminuted fracture. Comminuted. Osteocytes maintain contact with each other by extending structures they're called little canals. So canaliculi is the fancy word. Canaliculi. Compact bone consists of many circular units called osteons. Spongy bone's weight-bearing properties are allowed by its many beam-like structures called trabeculae. The organic substance secreted by osteoblasts to form bone matrix is called osteoid. Most bone is created by a calcification of hyaline cartilage, a process called blank ossification. So, simply because it's from cartilage, the root for cartilage is chondro, so it's called endochondral ossification. Endochondral. The periosteum, that outer wrapping of the bone, is held to the bone by blank fibers. You could call them Sharpie's fibers or perforating fibers. Blank joints are synarthrotic fibrous joints. that are formed by the articulation of two cranial bones. Well, that's a suture, right? Suture joints. The combined function of the paranasal sinuses is to, and this is arguable, I know, but lighten the skull would probably be the best answer. You could talk about adding resonance to voice and things like that as well. A foramen is a hole. Inferior to the eyebrows, small holes called blank are present in the frontal bone. They allow nerves and arteries to pass, as do most holes in the skull. So, in the frontal bone, right under the eyebrows, is the supraorbital foramen. Supraorbital foramen, or supraorbital foramina, to make it plural. Prior to suture formation in newborns, cartilage fills spaces between the cranial bones we call them soft spots in common speech, but the fancy word is fontanelles. The coronal suture is formed by articulation of which bones? Well, it's the crack, the suture that's in between the frontal bone and the two parietal bones. The blank is the largest opening in the occipital bone. That might be a little tricky at first, but it's the giant foramen magnum, right? Foramen magnum, the big hole. The blank suture is formed by the articulation of occipital, temporal, and parietal. So we're looking at the back, sort of lateral back of the head. That's the lambdoid, or sometimes lambdoidal suture. Small tunnels under the occipital condyles are called the hypoglossal canals. Hypoglossal canals. The external acoustic meatus is located in the temporal bone. The blank serve as passages for the optic nerves through the sphenoid bone. Well, these would be the optic grooves or the optic canals. The cristagalli is a small crest located on the, remember it's poking up like a shark's fin out the top of the ethmoid bone. Ethmoid. The temporalis muscle, which helps close the jaw, attaches to the blank, which is the anterior process of the mandible. Okay, the front or anterior process of the mandible is called the coronoid process. Blood vessels and nerves reach the chin and lower lip through the blank foramina, located on the front of the mandible. Okay, so they're not called mandibular foramina. This is a trick one. They're called mental foramina. Mental because they're on the chin. The blank gland sits in the hypophyseal fossa of the bloom within the sphenoid bone. Okay, we're talking about, well, hypophyseal refers to the hypophysis. And you could put that there, but most people call it the pituitary gland. So the pituitary gland sits in the hypophyseal fossa of the blank sella turcica within the sphenoid bone. The blank and the blank bones form the hard palate. Well, that's the roof of the mouth, the bony roof of the mouth. So that is the maxilla and the palatine bones. Maxilla and palatine bones. Perpendicular plate of the ethmoid bone and the blank bone form the bony nasal septum. The wall that runs right down the middle of the nose. So that's formed by the ethmoid and the vomer bone. The hyoid is unusual because it is the only bone in the body. Now, this is one I actually did not cover in our lectures. And it is unusual because it does not articulate with any other bone in the skeleton. And that's what makes it unique. It's found in the throat. There are 7 cervical vertebrae, blank thoracic, well there's 12, and blank lumbar, well there's 5, so 12 and 5. The blank is a bridge of bone located between the body and the transverse process of a larger vertebra. All right, well that's called the pedicle. The pedicle. The special name for the first cervical vertebra is blank. The superior surface of its lateral masses articulate with the occipital bone. So this top vertebra, C1, and I know you could say that's the special name for it, but the special name is the atlas bone. Atlas because it holds up the skull. The unusual large process that makes identification of C2 easy is called the, well, you could be fancy and put odontoid process, but most people just call it the dens, the dens. The spinous processes of most cervical vertebrae are, well, they have a split. They have like a snake's tongue, right? And they're called bifid. They're bifid. They have 2 points. A normal increase in the lumbar curvature of the vertebral column is called lordosis. Lordosis. An abnormal mediolateral curvature of the vertebral column is called scoliosis. The sternum is formed by the fusion of 3 portions: the manubrium, the body, and the blank process, which is the tip, called the xiphoid. Some people say xiphoid process. The normal human skeleton contains how many total ribs? Well, there's 12 thoracic vertebrae. Each one of the vertebrae has 2 ribs on it, so 2 times 12 is 24. 24 total ribs, 12 pairs. The 2 false rib pairs, which do not have an anterior connection at all, are called the floating ribs. The lateral bone of the forearm. Now remember, anatomical position, you got to hold your palms forward. So the lateral bone would be on the thumb side, and the one that's on the thumb side is the radius. The proximal end of the humerus, that's the one closest to the head, up where the shoulder would be, includes a large groove between its tubercles, called the blank, in which a tendon of the biceps brachii attaches with. That's fine. Well, it's in between the tubercles, so it's called the intertubercular groove, or some people call it the bicipital groove. The distal end of the humerus, the other end, has 2 condyles for articulation with the antebrachium, the forearm. The lateral one is called the blank and articulates with the radius. Okay, that would be the capitulum. The circular one looks like a ball or a round head, called the capitulum. Remember, the trochlea is the other one that articulates with the ulna. The blank process of the scapula articulates with the clavicle. So we're talking about the acromion process, or the acromial process, it could be. The blank fossa of the scapula is a broad fossa inferior to the spine. The spine's in the back, and we have that triangular area below the spine, so it's called the infraspinous fossa. Infraspinous fossa. The hand contains 3 types of bones. The blank, well, it starts off with the blank of the fingers, the metacarpals of the palm, and the small carpal bones of the wrist. So we need phalanges go there, the phalanges of the fingers. The 5 fingers are numbered so that pinky finger is always, well, remember the thumb is 1. So pinky has got to be number 5. It's always numbered 5, digit 5. The coxal bones are formed by fusion of 3 bones: ilium, blank, and pubis or pubic. And this is the ischium. Ischium. The very large opening in each hip bone is called the blank foramen. Ironically, its name means closed. That would be the obturator. Obturator, O-B, obturator foramen. The blank, or vinegar bowl, is formed by all 3 bones that make up each innominate bone. Again, a hip bone question. This vinegar bowl, articulates with the femurs. So that would be the acetabulum. Acetabulum. The weight-bearing bone of the anatomical leg is the blank. So the anatomical leg is either the tibia or fibula. And the weight-bearing bone there is the tibia. The bones that are collectively called the tarsus, that would be the ankle bone, sort of. More correctly, it's the tarsal bones, right? Talus, navicular, cuboid. All right, what are the other ones here? Well, calcaneus would be the heel bone, it's missing. and 3 cuneiform bones, the medial, intermediate, and lateral cuneiform. So talus navicular, 3 cuneiform bones, cuboid, and calcaneus. The bulge that can be palpated as one's medial ankle bone, right, is actually the blank of the tibia. So the large lump that you reach down and touch, and you say is your ankle bone, is the medial malleolus of the tibia. You could just probably put the malleolus of the tibia because we know it's already medial from the question. 3 categories of joints are blank, synovial, and blank. Fibrous, cartilaginous, and synovial. Give an example of a symphysis joint. Well, that one's really easy. The pubic symphysis is usually good enough. You could also mention the intervertebral discs. Those are also examples of symphyses. What is meant if a joint is said to be amphiarthrotic? That means it's semi-flexible. Right? Synarthrotic means no flexible. Amphiarthrotic here means kind of flexible. And diarthrotic means freely movable or totally flexible, right? Name the specific type of joint where the tooth sockets join with the teeth. This is a special case called a periodontal ligament, known as a gomphosis joint. Blank are flattened fibrous sacs found in synovial joints containing synovial fluid. These are the bursae, or bursae, some people say. Bursa singular. And I think we made it. All right. I'll see you guys for the next video. Thanks for watching this one. Bye-bye.